Hello, and welcome to San Joaquin General Clinical Group's presentation on SARS, presented by Gil Gazda, Nisa Swanston, Shantoy Jackson, and Ryan Daco. I'm Gil Gazda, and I will be presenting on the origin, history, and lasting outcomes of the SARS epidemic. Severe acute respiratory syndrome, known as SARS, is a contagious and sometimes fatal illness inducing acute respiratory distress and atypical pneumonia in the infected. The disease is caused by SARS-associated coronavirus, identified as SARS-CoV, or more recently updated as SARS-CoV-1. It is an RNA-type virus known to infect and reside in mammals and birds. The coronavirus group is known to cause respiratory illness such as the common cold, MERS, Middle Eastern Respiratory Syndrome, and coronavirus disease 2019, COVID-19. SARS was first reported in Foshan City, Guangdong Province in China during 2003, eventually spreading across the globe to 28 countries with a reported 8,098 cases and resulting in 774 deaths. The United States reported 73 cases with no deaths. SARS is believed to have a zoonotic origin. Zoonosis is to have occurred between either a civet cat or a Rhinolophus bat, as both are a source of nutrition in the region of outbreak. For years, the source has been a point of debate as the coronavirus species found in civet cats is most homologous, having a similar viral structure to the SARS-CoV-1 specimen cultured from human hosts. The bats, however, are considered the natural host reservoir for the SARS-type coronavirus family. A 2017 study of Rhinolophus bats provided stronger evidence to the argument that the bat was the originating source of the SARS infection. The study revealed a genetic link in the coronavirus types residing in bats to the SARS-CoV-1. Multiple SARS-type coronavirus species in the Rhinolophus carry the same genetic markers and proteins which allow SARS-CoV-1 to enter human cells. After the 2003 outbreak, the following year there were only 4 reported cases of SARS illness across the globe. 3 were accidental laboratory-acquired infections, and a 4th highly isolated and rapidly contained infection. Scientists have attributed the quick containment of the disease partially to its pathology and partially to luck. SARS-CoV-1 thrives deep within the lungs, rendering it less transmissible but with high mortality. Other forms of highly contagious coronavirus types, such as the common cold and SARS-CoV-2, multiply and reside in the upper respiratory tract as well as multiply easily in the nasopharynx area, where contaminated droplets are easily expelled. SARS-CoV-1 patients did not become highly contagious until they were extremely ill and had already sought medical attention. SARS-CoV-1 never spread into a developing country with less developed healthcare systems. Its prevalence in first world countries allowed for adequate measures and treatments to occur before wildly spreading. While not only discovering a new illness which spanned the globe, SARS also had a profound impact on how nations respond to and behave in a communicable disease crisis. The outbreak uncovered multiple blind spots in government and healthcare systems, which exacerbated the spread of the disease across the globe. A workshop of top scientists and physicians designated a lack of timely and accurate informational flow to the public as detrimental. The coordination between inefficient government organizations and agencies slowed down reaction times to fighting the crisis. And finally, political systems and countries attempted to contain the virus alone instead of coordinating efforts. As a result, governmental and health official organizations promoted open information disclosure practices, hoping to stop inaccurate rumors and stymie adverse and irrational public reaction, often resulting in economic failures and crises in affected areas. The SARS outbreak also induced the creation and implementation of drastic control procedures and plans of action related to communicable diseases. Public and healthcare systems response and preparedness plans respond to address containment, isolation, and travel from local to global perspectives. Many of these plans are currently being executed and exercised in response to the COVID-19 pandemic.
Okay, transmission of the SARS virus. Very, very similar to COVID-19 that we're seeing. It is spread from person to person. It is a droplet precaution in the hospitals. And person to person meaning any respiratory aerosol spray from talking or sneezing or coughing. And it has to come from the infected person to an uninfected person and get into that uninfected person's mucous membranes in their face, in their nose, mouth, eyes. It also can live in your mucus, saliva, feces for up to 4 days. And in some studies of SARS, when it was circulating around China in 2003, they found that it can persist in the air for some time. One interesting study that I found in an apartment building, a huge apartment complex full of different building blocks, the residents there thought that it was persisting through the plumbing there, where it started off with one man visiting and he was infected with SARS, transferred it to his brother and sister-in-law, and within 1 month's time ended up with 321 positive SARS cases just within that apartment building alone, or apartment complex rather, and 99 cases just in that one block of apartments. So highly, highly contagious disease. Also, just wanted to add an extra note that they came up with the term called super spreading, where one infected individual would come into contact with greater than 8 other people. And this phenomenon was seen with the SARS virus in China. They were able to track a bunch of individuals, I think 77 different individuals that confirmed SARS cases, and tried to track all the people that they came into contact, who came down with it, and so on. And that's the picture that I have in the background, although grayed out. But it is interesting to see how this cascade of contact just really blows up exponentially. And then also, because SARS was misidentified early on, and again, that is what contributed to its transmission. People thought that it was some sort of unknown pneumonia or TB, and they hadn't had very strict precautions and isolations taking place in the hospitals, and that's what was how the virus was being spread, not from health workers again, but from visitors, family members coming to visit sick patients. So very important. I know a lot of families here in the U.S. with the spread of COVID are struggling with the fact that they can't visit their family members, but it is definitely needed to keep viruses from spreading. Interesting note. Okay, identifying hotspots and preventing transmission of the SARS virus. The research that I was doing in how China began cracking down on the spread of this virus, because the World Health Organization had said, hey, look, if you guys don't control this, this could be a major disaster. And so what do you know? A lot of the things that I was reading about were the exact same precautions and closures that we're seeing now with COVID-19. They believe this disease virus was being spread in hospitals, and then airplanes through travel, and then I told you about the one apartment complex. So just any crowded area where droplet precautions can just spread out amongst other people, get into the mucous membranes. Next thing you know, they're sick. But I just thought it was very interesting. China began a campaign of sorts to educate the public on the disease and how you could get it. And they began disinfecting public places and quarantining infected individuals, body temperature checks for all air passengers. They closed many businesses and decided that the economic impact was did not outweigh the health impact. So they felt that that was proper to do, and quickly realized that if they were going to get on top of this thing, that they needed to figure out what it was early on and take the proper isolations. And all of those actions worked. And they started seeing a drop and another drop and another drop in each case of and all the cases of SARS until it got down to zero. And then they really had a handle on it. So I guess what we're doing right now for COVID-19 is definitely proper, and I believe that it's definitely working. So just very interesting foreshadowing from the SARS events in 2003, now COVID-19 in 2020.
Hi, my name is Shantoy Jackson, and I will be talking about the pathophysiology of the virus. So our virus has an S-spike protein, and it works as a key that needs to fit onto a lock. And the lock is the ACE2 receptor on the healthy host cell. And the host cell is a type 2 pneumocyte found in the lungs. So when this S-spike protein meets up with the ACE2 receptor on the cell, it is granted entry into the cell via endocytosis. Once the virus is in the cytoplasm, it needs to uncoat and release its RNA so that it can start replicating. And it does this by binding to ribosomes within the cell and making up polypeptides, which can be used to make new parts of a virus. It also uses RNA-dependent RNA polymerase to make more copies of its own RNA, which can then go and bind to other ribosomes and make more polypeptides. It also uses proteases within the cell to break apart these polyproteins and make them into spike proteins and other proteins and building blocks of the virus, which are then sent to the Golgi apparatus, where they're repackaged and sent off in vesicles. They then exit the cell via exocytosis. All of this viral replication is very damaging to the cell, and these cells will then start to release chemicals called interferons, which act as an SOS to let nearby cells that there's an invader, and these cells will then begin to produce antiviral peptides. And that means that if they are attacked by the virus, that they may be able to break the virus down. They also release cytokines, which are pro-inflammatory chemicals which activate nearby alveolar macrophages. Now, these macrophages then secrete inflammatory chemicals, some of which are interleukins, which can cause holes to appear in the pulmonary capillaries. And some of this fluid can then leak into the alveoli, which makes a thicker membrane so that oxygen and carbon dioxide can't exchange as they're supposed to. This can lead to hypoxemia and hypercapnia and even respiratory acidosis. These cells are also dying via apoptosis, where they're bursting and releasing more virus into circulation.
So this is Ryan Dacko. I'm here to talk about the treatment of severe acute respiratory syndrome, also known as SARS. There's no confirmed treatment that works for every person who has SARS, so it's different for everybody, and also there's medications or treatments that'll help with the symptoms of SARS. So antiviral medications and steroids can reduce lung swellings, but aren't effective for everyone. Also, antibiotics, they help stop the bacteria that causes pneumonia that follows along with SARS. Supplemental oxygen and a ventilator may be prescribed for helping with breathing, but in severe cases, blood plasma from someone who's already recovered from SARS may also be administered. But there's no evidence yet to prove that this is effective. So pretty much the only way to stop the disease or slow it down would be, like any other disease, would be prevention. There's no vaccines that can be given for this disease, but for human trials at least. And there's no confirmed treatment for this disease, but prevention is key. So here's some ways that you could prevent it from being diagnosed with disease. Number one, pretty much with everything, is wash your hands frequently. Also, if you're dealing with anyone that's infected, wear disposable gloves and make sure you dispose of them properly. And if you're gonna go into the same room as someone with SARS, you'd want to wear a surgical mask. So also, with that being said, any surface that may have been contaminated by the virus, you'd want to disinfect it with the proper cleaning instruments. And then anything that the person with SARS comes in contact with, it must be washed or sanitized. And also, all the steps have to be followed, even if the symptoms have stopped for SARS, they've gone away. You must follow it after 10 days. And also, if you have any kids or if anyone is suffering from the disease, you'd want to go in heavily populated areas such as schools or malls. So it's pretty much isolation until the symptoms of SARS goes away.